So it is my pleasure now to turn it over to Lauren Wright. And Lauren is the Executive Director at the Illinois Partners for Human Service. And for anyone who may be unfamiliar with that organization, Illinois Partners is a coalition of more than 800 human service organizations representing every legislative district in Illinois. So it is my pleasure to introduce Lauren, and Lauren, just let me know and I will advance the slides for you.
Great. Thank you so much, Kristen. And thank you, Secretary Ho. I think your opening statement really reminds us of the importance of radical imagination in this time. And I am so grateful that you are our leader of human services during this time and for everything that you have done to ensure that our organizations are supported, but also that equity is at the center of our response. So thank you so much for your opening remarks. We really appreciated that.
Thanks, Lauren.
Yeah. So as Kristen said, my name is Lauren, and I actually have had some weird technical issues. So I'm on my phone going back and forth between the two screens. So if you have any difficulties hearing me, please let me know, and I'm just going to turn my video off. But I'm really grateful to be here, and I'm really excited to give just a brief overview of some of the things that we've learned from our coalition partners across the state. And Kristen, you can go ahead and advance to the next slide. So I just wanted to start out with a really big thank you to all of our health and human service providers and the nonprofits. To all of you, obviously, who are called in today, but also to everyone across our state. We have seen the resilience of the human service sector. We have seen how important it is for our providers to be supported, but we also have seen the interconnectedness of health and human services during this time. And we have to begin with gratitude to all of you for everything that you do to support our communities. We wouldn't have been able to respond to this pandemic as a state without all of you serving on the front lines in your communities. So I just wanted to start with immense gratitude for all of you and for everything you continue to do in response to this crisis. You can go to the next slide. So Illinois Partners, as was mentioned, we are a coalition of 800 health and human service organizations, and we do represent every legislative district in Illinois. And so what our mission is to lead efforts to fully fund human services and to ensure that all Illinoisans can reach their full potential and have access to a sector that is equitable, sustainable, and speaks with a collective voice. So once COVID-19 hit, and I actually have been in my position as executive director for less than a year. And so there's no way I could have prepared, I don't think, for a global pandemic in this first year of being in a leadership position. But I knew that our approach fundamentally had to start with listening and learning directly from our partners' experiences. So our coalition is broad across in terms of geography, but also in terms of service area. And we really wanted to make sure that any response that we had as an advocacy organization was centered in the feedback and experiences of our partners. We also wanted to make sure that we were able to connect key decision makers to the knowledge and experience of health and human service organizations, as well as collaborate directly with trade associations as well as regional coalitions to amplify both issues of equity and the interconnections between health and human services. And I think DuPage Federation has been an incredible example of a regional coalition that has not only responded to the needs of the organizations within the Federation, but also has really informed Illinois Partners' response and has been a part of our learning as we amplify the experiences of our partners. So I'm really grateful to DuPage Federation for all that you have done in response to COVID-19. It's been incredibly important. So you can move to the next slide. So we as Illinois Partners led, I think now up until this point, we've led now close to 30 virtual focus groups that were conducted via Zoom. And with participation from more than 200 human service providers across 7 regions in Illinois. And what we learned a lot of different things clearly from those focus groups, and that can't be summed up, I don't think, in a quick presentation. But there are some overarching themes that I think have been really important that I want to highlight. So one of the most important things that we realized through the feedback of our health and human service partners is that we cannot separate health and human services. Human service organizations are absolutely essential to a robust public health response. And we've really been shouting this from the rooftops since the onset of this pandemic. And we are lucky that we have an administration that knows and values human services, but I think drawing that connection, at least in the early days when we were very, very focused on addressing the health concerns, it was important to really show people that to shelter in place, as Secretary Ho said, that's a privilege of having shelter. To be able to social distance, that's a privilege of being able to isolate. These are all things that many of the people, the clients and communities that our organization served were unable to do because they didn't have that access. And so really making sure that our key decision makers understand that you cannot separate health from human services. They're both equally important and interconnected. Providers are resilient and adaptive in responding to the needs of their communities. This is something that I cannot say enough. When we've just heard so many stories of resilience from our providers, people who have, and leaders who have stepped up to the plate to respond to the needs of their communities. And for many organizations, demands significantly increased. For example, one of our partners is Northern Illinois Food Bank, and they have seen between a 50% and a 300% increase at many of their locations across Lake County. And many of those, the people accessing these services are new clients, so they haven't accessed a food bank before. And that's just one, I think, of many examples of how the demand for human services and the demand for not just for basic needs such as housing, so shelter, food, but also the demands for mental health services and so many other areas are just going to continue to increase throughout the duration of this pandemic. And as we move further into an economic downturn and economic crisis, we have to be aware that as demands for services are increasing, we have to prioritize funding these organizations. And then the third is that we need an intersectional approach to investing in community response with racial equity really at the center of that approach. And as we all have known and read the statistics about the way COVID-19 is disproportionately affecting Black and Latinx communities. The Illinois Department of Public Health data shows that while Black and Latinx residents only represent 14% of the state's overall population, they account for 56% of infected patients and 40% of deaths. And we know that this is representative of a systemic issue, and the murder of George Floyd further shows how systemic racism in our systems and what that does to access in terms of health and well-being. We cannot respond to this pandemic or any issue without racial equity really being at the center of our approach. And so that's something that we have really reflected on and focused on and heard consistently across the board as important from our partners. We can move to the next slide. So we as Illinois partners have been listening and learning from our coalition members, and we kind of distilled the following recommendations for our legislators, for state agencies, and for the philanthropic communities as well. So our number one recommendation was for human service providers, we have to be reducing administrative burden wherever and whenever possible. And I think with the COVID-19 statewide response fund, we saw some really great a really great response from the philanthropic community. But we also saw initial grants that were for things like rental assistance for the clients of our organizations, with no acknowledgement of the administrative costs that it takes to actually administer those services. And we can't ignore that. And we also need to acknowledge that for folks who are working in residential facilities and who are staying for sometimes months at a time, these types of work environments require hazard pay as well. And so really making sure that our leaders understand the actual cost of delivering services in a pandemic, and how important it is to fund that fully. We also have heard consistently throughout the state the importance of expanding internet access, and Secretary Ho touched on this as well. This was heard quite a bit downstate, but as well as throughout different parts of the city of Chicago. It's really important. If we want to be able to innovate, we have to make sure that access to technology, access to internet is more equitably distributed across the state. We can't be focused on utilizing telehealth services if the people who really need those services the most don't have internet access. And so we really need to make sure that that's something that is focused on in policies addressing this pandemic. And then we also know that for human service organizations, our health providers also just saw such difficulty in accessing PPE, and we don't at all want to minimize how important it is for our hospitals and our health centers to have adequate PPE. But for a while, our key leaders were forgetting that human service organizations need access to PPE as well, and how you can't be a caregiver to someone and help with all of their activities of daily living without appropriate protective equipment. And so really being a connector and making sure that our organizations and our leaders know that human service organizations also need access to PPE throughout the duration of the crisis. You can go to the next slide, sorry. Thank you. We really wanted to center and acknowledge the disproportionate effect of COVID-19 on the Black and Latinx populations. And we have been advising the philanthropic community as well as our leaders to invest in community-driven organizations that are led by folks from those communities. And so we, as Illinois partners, had to do our own reflective and continuously do our own reflective work on how we make sure that what we're doing is centered in equity. And part of that has been to amplify community-driven organizations led by people of color who are really on the front lines of this response. How do we amplify the work that they're doing? How do we connect them to the resources that they need? And how do we have that that intersectional approach to really highlighting the needs of our coalition partners? And so that's something we've been amplifying, making sure that human service leaders are at the table for budget and funding decisions. We all know what it feels like to have decisions made that feel like the interests of our sector are not at the center. And so as we have been working with our leaders, we've really encouraged them to make sure that human service leaders are at the table for those decisions. And then, as always, prioritize full and timely payments to human service providers. We can't, I feel like I just say this all the time, that anything that is inhibiting full and timely payments to human service providers is a direct reflection of how our leaders value human services. And we all know that we're in a tight budget year. We all know that things are tricky, and we're going to have to make sacrifices, but those sacrifices should not be on the backs of the communities that need them most. And so really making sure that that's at the center of our leaders' response is something we've been promoting. So I think that's it for me. I'm so grateful to be a part of this summit, and I am looking forward to hearing more from our panelists coming up. So thank you.